Okay, so we mentioned the first talk was all around new AI platform coming in, using a clinician and technology to build it. Now looked at the safety around AI. Now look more about compliance. So I introduced Michael Bell. Is Michael Bell here? Oh, it's over there, so I couldn't see you, Michael. So DTAC is the Digital Technology Assessment Criterion. And Michael's a partner at Acorn Compliance. We've got to look at patient safety, compliance, GDPR, all the kind of things that we've got to think about. How's new tech come into effect? What are the risks that we have with it? And Michael's going to take us through that journey.
This mic's on, right?
It is.
Hello. Thank you so much for this opportunity to talk about DTAC today. So I'm just waiting for the first slide to come up and I'll begin. So while we wait for that, I'm Michael Bell. I'm a partner at Acorn Compliance. I've been working myself in the healthcare space for over 25 years. I did work for NHS. I've worked for NHSX when DTAC came into force. I was there during COVID. So a lot of experience in assessing new technologies, that needed to be deployed during that time till the elderly, vulnerable and isolated. But day to day now, I work for startups and global health techs as well, startups, scale-ups, global health techs, helping them with compliance and regulatory work. So that was a really good talk I've just listened to right now. It's an emerging space around AI, of course. So what I want to talk to you today about the NHS Digital Technology Assessment Criteria. So this is the baseline standard for, just trying to work this clicker. It's a baseline standard for entry for procurement by the NHS. So if you have a digital innovation, health tech innovation, and you're trying to bring this to market, and NHS is one of your target audiences, you're going to need to be DTAC compliant, Digital Technology Assessment Criteria. So what on earth is DTAC? Maybe you know, maybe you don't. Okay, so DTAC is a compliance framework. It's a successor to something called DAQ, which was used for NHS Apps Library in the past. So it has a number of different strands of compliance in it, okay? Starting with clinical safety, very, very important. So this is the DCB 0129 legislation. And that's going to be something you need to look at and be conformant with if you're going to become DTAC compliant. It also has within it data protection elements, so the Data Security and Protection Toolkit, just another acronym, DSPT, right? Which you're going to need to answer a bunch of questions, 50 or so questions, which all focus on, at an organizational level, what have you got in place? What policies and procedures have you got around data protection and privacy? What policies and procedures do you have around cybersecurity threats to mitigate those? And what training have you been doing with all of your staff to make sure everyone is aware? Because compliance is a team game. So that's data protection, security side of things. You're going to need to certify with something, a national body, which is linked to the National Cybersecurity Centre called IASME, and they provide a Cyber Essentials certification. That's again an organizational level certification, which means if you're following the principles of that, if you're compliant with that, it means that you're following good cyber practices. They're embedded across your organization. Things like, have you got software firewalls turned on? Making sure your policy tells you not to use public Wi-Fi because it's dangerous. Things like that, okay? Making sure you've got antivirus installed. Also, what's really important if you have a digital innovation is that you have it penetration tested. So what does that mean? So it means if I've got a technology product, I need to do something called a penetration test, because what that's going to do is check whether I have any holes in my cybersecurity defenses, right? It's going to say, okay, we're going to try to hack your system effectively. So we do at Acorn Compliance both automated and manual pen testing using over 8,000 tests. That's how serious cybersecurity is. Okay, there's a lot to do with it in terms of pen testing. Moving on to interoperability. Now, all my time working in the NHS, I used to work in the NHS a long time ago, as I mentioned. Interop hasn't really changed a great deal in the last 10, 15 years. It's like seen as a part of the Holy Grail to get systems to talk to one another, but it hasn't changed much on the ground at all, right? So Interop is asked for in DTAC, but all you need for DTAC is a strategy. Okay, you don't need to be linking to Epic or Cerner. You need a strategy to do that, okay? You need to have an awareness of it, but also within the Interop section of DTAC, you need to be articulating how you're following best practices and open standards around API development. So things like OAuth through authentication and so on, right? You know, those good things, you're going to have to articulate them. And usability and accessibility, the final kind of two areas of DTAC. Usability, let's break it down simply. It's about user research. Are you taking feedback from your customers, your users, your audiences, your personas, and are you then using that to drive your product development roadmap, okay? And accessibility, of course, is about ensuring that as many people as possible can use your technology. So accessibility links to a global standard called WCAG 2.1. And what it looks at is to make sure that any individual, and this is particularly important for patient-facing applications, can use it. So people with sight difficulties, hearing impairments, whatever your tech's trying to do, you need to consider those personas and audiences really carefully and make sure you follow the WCAG standard for that. So that's DTAC in a nutshell. But why do you need it for your innovation? Yes, it's the baseline standard for procurement or piloting with the NHS. So it's a prerequisite, but it's not just enough to do DTAC once. It's not something you do and you forget about it and put it in a cupboard. Like everything in compliance and regulation, you need it's a living, breathing thing. It's a key consideration of anything you do with the digital health tech innovation. You need to maintain it. So what you need to really do is to stay agile to opportunities and ensure your products are safe. You need to put in a framework, not just for DTAC, but to maintain that alongside any other regulatory standards you're working to as well. You need to embed a culture of compliance. It's really important. So why a compliance culture in a bit more detail? Well, if I haven't got one and I'm seeing this DTAC as a one-off thing that I do, I'm only going to be assessing my digital health innovation at that point in time, okay? What I need to be doing is embedding within my development lifecycle approach, my software development lifecycle, whatever you want to call it, a way to impact different features that I'm bringing into the product for clinical safety. So maybe I've got a roadmap, I've got 10 new features I'm assessing as part of my product backlog. What I'm going to need to do is have a team conversation and say, okay, feature X, we want to put that in. What does that mean in terms of clinical safety? Could this potentially lead to patient harm? Could it bring up any other privacy risks which we haven't seen yet? Is this likely to leave a security vulnerability open that could be attacked? And there's many different tools and techniques you can employ to do this, okay? But it's really important. The main message here is it's a living, breathing thing. As you develop features, make it part of your software development lifecycle and process, okay? What you're going to do then is ensure you don't build up what I'll call compliance debt. So in engineering, I'm from an engineering background, we have a kind of phrase called technical debt, okay? Technical debt occurs when we take shortcuts, when we don't follow good practices and best practices. It might help us with an MVP, but we're probably going to be left with a whole load of code we're going to need to unpick and change later on. Compliance debt's exactly the same. So if I'm not considering compliance from day one, what's going to happen is I'm going to be building all this compliance debt. If I haven't considered safety, security, privacy, I get to the point of launching my product, NHS say, we'll love to pilot this, it's fantastic. They're going to be like, where's your DTAC file? And you're going to be like, oh my God, especially if you haven't considered it, right? So, and then you're going to be facing a long time, a big blocker. You're not going to be agile to opportunities. You're going to be much behind the curve, trying to scramble to get that stuff together, and it may even mean you have another year of development to do, right? Because you find out all these holes from a security, safety standpoint. So it's about minimizing compliance debt. So make it part of your product roadmap. That's the biggest advice that I give. Make it a team game, because everyone has different experiences around safety, security. Everyone has something to bring to the table in a development team. You've got to get that expertise and that input as you go from everyone and make it everyone's responsibility, because the more people who are aware of compliance and culture and regulatory requirements, the better, because it means everyone's thinking about it. If I'm going to a product backlog meeting for my innovation, I'm going in there thinking, okay, these features I'm presenting as a product manager, like I've got an awareness of how this could be maybe clinically unsafe, or maybe we need to do more mitigations in to make it safe. You've got to be having that mindset, and the more people that have that in an organization, the better, because that's how we're going to get to transform healthcare delivery together, by bringing innovations to market, by removing barriers to innovation, and by thinking in a compliance mindset. That can help with that. So I'm not sure how much time I've got left, but I'll try to get through this. So basically what I've done is, what I kind of articulate and advocate is a progressive compliance approach, okay? So what does this mean? Well, it means, because I work a lot with startups and I've had startups myself, I know the pressures in the startup. What are the things I can do, and when should I do them to maybe help my compliance journey? So at the prototype stage, when you're building your MVP, maybe start thinking about the risks that might occur. So thinking about what harm could come to a patient because of this feature. Log it down in Excel. You're going to need a clinical safety officer ultimately to help you kind of navigate that space, okay? But if, as long as you're thinking in that compliance way, you're going to have at least some ideas of where your product might have safety concerns, okay? So there's a product level here, and there's an organization level here. So at an organization level, some really simple things you can do. We're going to take 2 seconds. ICO registration, Information Commissioner's Office, register with them, because if you're handling personal data, you're going to need to be registered with the ICO, okay, Information Commissioner's Office. Get an ODS code from NHS England, because you're going to need that later on to submit your data security and protection toolkit. Okay, so these are simple things organizationally, and as I said, at a product level, start thinking about hazards that could occur. Maybe start thinking about security by design and secure development policies you could implement in the organization to assist with that approach and that way of thinking. And make sure you kind of know your audiences, your personas that you're targeting for the device, and begin to engage them, begin to acquire feedback from focus groups or using other methods, okay, user research, so you can ensure your product's being driven by the audience it means to serve, okay? And as you progress to pre-production, maybe you're about to do a pilot with the NHS, that's when they get a bit more formal about things, right? That's when you might be starting to get asked for evidence, even at an early stage when you're discussing the pilot. So think about then making sure you have a clinical safety officer, making sure you take in those early identified potentials for safety, potentials for harm, and putting them into a formal document, okay, which can be read, which can be understood by an NHS clinical safety team. Okay, and in terms of at an organizational level, what you want to be doing too is thinking about cyber essentials. So maybe do a little audit in your company, even if it's just one of you, and say, okay, have we got firewalls turned on? Have we got antivirus software installed? Okay, simple stuff like this, because that's going to help you with cyber essentials, which you're going to need by the time you get to here, okay, by the time you get to that point of being able to put your product into the hands of clinicians or patients. And as you move more towards live, it just gets deeper. But the thing is with this, when you get here, everything you've done in these other stages is going to then help you remove blockers and get to market really rapidly, okay? Because you're going to have a lot of the artifacts already, even though they're not formalized, and you're going to be able to then formalize them a bit better, you know, round off that clinical safety case, complete the SPT by doing some of the things here, like getting templates for policies in place early. That's going to help with the SPT. So everything you're doing here is supporting this kind of go live, okay? And embedding these early is going to help you with that DTAC evidence file. So DTAC, again, clinical safety, data protection and privacy, technical security, interoperability with other systems, usability and accessibility. It's about taking small steps and moving towards this goal of going live and piloting the product to get an innovation to market. So I want to tell you a little bit about what we've done at Acorn to support getting to market quicker. I'm really passionate about helping innovations get to market, and there's so many good ideas out there, but a lot of people hit blockers with compliance and regulation, okay? So what we've done, the theme is Acorn, so that's why we've called the platform Squirrel, but we have an AI-based platform, of course, which basically helps Squirrel's an AI guide. It'll help you through the process, it'll help you understand DTAC, it will also, it will also help create the compliance artifacts. So it helps creation of evidence based upon your inputs, right? You input the Squirrel, helps out. But of course, what's really important with compliance regulation is humans, okay? This is an area to be taken incredibly seriously. And right now, you know, there's no way an AI, for me, can generate a whole evidence file and that can be robust enough. You need human input, human guidance to kind of validate that evidence and extend that evidence above the baseline that Squirrel provides. So this is the way the market's definitely moving for me around compliance and regulation. And this is something we've done at Acorn to help. So if you haven't seen it yet, you can check out our stand. We've got a demo of Squirrel running, and you can see how that's going to be assistive with the DTAC process. So I think I've probably hit about the 15 minutes now. So there's a QR code here if you want to arrange a chat with myself and the team. Happy to speak to you, give you a full demonstration of Squirrel, tell you more about compliance, answer your burning questions on compliance. It's part of what we're here for. We've done a lot in the past about doing free consultancy and having DTAC drop-in sessions. That's more of what we'll be doing in the future. So please check us out on the website. There's webinars on there you can look at too, in a more extended version of this presentation. Thank you.
Thank you so much.